Today on the show, consumerism, cultures of happiness, and AI in cancer care. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. The ACCC 51st Annual Meeting and Cancer Center Business Summit, or AMCCBS, is where cancer teams discuss business, policy, and technology to enhance patient care access and quality. Joining us today is Webb, a healthcare futurist and best-selling author.
I'm really excited about the opportunity to share some ideas that could be outside of the industrial echo chamber. There's a lot of sort of churn associated with where things are going related to consumerism, to the dynamics associated with practice management, virtually all things related to artificial intelligence and enabling technologies. So I'm really excited to share some fresh research on really what the future really looks like and how we can leverage new technologies and new practices to thrive and to improve the access and quality of patient care.
Talk about your upcoming session. What can attendees expect to learn?
In my consulting practice, we do a lot of deep research in the future of healthcare. And we look at over 500 trends, and we divide these trends into three categories. There's the outer space, which is it'll happen within the next 3 years. Then there's the near Earth, which means that it's coming in for a landing, and we'll see it this year. And then there are the landed trends. And even the landed trends, oftentimes, not everyone's aware that these trends have actually landed. So we're going to take these 500 trends, and we're going to really talk about three trends that I think impact the practice level in the biggest possible way. And these are landed trends and near Earth trends that will be in play for sure in 2025.
What value will people get by attending this event in person?
Well, I hope that I'm able to convey some novelty that they can apply immediately after my session. For an example, one of the major trends that we're dealing with in 2025 is what we now call hyper-consumerism. We've talked about patient consumerism for some time, but now innovators and organizations are rapidly creating consumerized options for patients. In other words, patients look at healthcare the way they look at ordering groceries, right? They move their thumb a few times and groceries appear in their front door, right? And patients really today want friction freedom. They want relevancy. They want customization. They want transparency. And really, they want humanity. They want the relationship to be more than just the transaction of healthcare. So the best organizations in healthcare and the best practices, they're going to make the transition from the transaction of healthcare to the experiential value of healthcare. And keep in mind, I realize that these practices that are in your organization already are doing great work and delivering beautiful experiences. But with some of the information that I'll share, I'll kind of help them understand what the current baseline level of expectation is for patients and how we can go beyond that level of expectation to create experiences for patients that are amazing while improving patient care and patient quality and access and all the other things we like to do from the transactional and mechanical side of healthcare.
You wrote a book on creating cultures of happiness. Are you planning to share the research from that book?
Right now in healthcare, we have one of the highest levels of burnout. We have people with advanced medical degrees that are leaving healthcare entirely to go to work in other industries so they can show up at dinner with their family. And so what we're doing now is we're really looking at these incredibly powerful ways to leverage robotic process automation and new best practices to take the pressure off staff and providers, to give them the opportunity to really do what they signed up for in the first place in healthcare, and that is deliver beautiful, efficacious, and humanistic care to patients. So I'll definitely be sharing some research from that.
AI is, of course, on everyone's mind. How does it fit into cancer care?
This is really exciting because the problem with artificial intelligence, if you stop somebody in the street, chances are they have a completely different definition about what AI is and what it means and what they should do about it. And what I wanted to do in a very practical way is to take artificial intelligence and to talk about the four derivatives. What does it really mean at a practice level? What can we do in terms of innovation value, experiential value, clinical value, and enterprise value? How do we leverage artificial intelligence to reduce costs by as much as 30% while increasing returns on stated strategy by as much as 60%? How do we have the lame robot do lame robot stuff so that we can do beautiful people stuff? I also talk a lot about this concept of collaborative intelligence. So many people are talking about AI, but really when you think about the term AI, artificial means fake, right? It's fake intelligence, meaning that it's not human. And so when we really think about what we're talking about related to artificial intelligence, it's really about the combination between AI, fake intelligence, with human intelligence, real intelligence, and how we use the machine to do things that humans shouldn't be doing so that we humans can do the things that we should be doing. And that is engaging and creating thoughtful and beautiful relationships with the patients that trust our care.
Thank you, Nick. See the show notes for details on Nick's opening session at AMCCBS and the link to register. Until next time, for the CancerBuzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.